My name is Benta Opande. I'm a teacher by profession. I teach chemistry and biology. Although currently I'm not actively teaching, I stopped teaching sometime back in the year 2000. And two, when I joined the teacher leadership and management movement, I have worked for both Kenya National Union of Teachers and the Kenya Union Post-Primary Education Teachers as a national official. And so I have a lot of experience in the teaching environment. Currently, I am the General Secretary and also the Chief Executive Officer for Kenya Women Teachers Association. Kenya Women Teachers Association is a welfare association for women teachers in Kenya, which covers teachers from early childhood all the way to tertiary institutions. We also cater for teachers in the private sector and also retired teachers. We also are now getting into the field of bringing together teachers in the non-formal sector, like teachers who are teaching children in the informal settlements. So generally, all women teachers are candidates of becoming members of our organization. Yes, and this organization was registered in 2007. October 25th. It was registered after having been in the union leadership. Several women came together and realized that there are so many gaps that existed in teacher leadership, and many of the women teacher issues were not being addressed by the then very chauvinistic union leadership. So women came together, and through the support from an organization from the Netherlands and Duwatu, who are their affiliate in Africa, we brought women teachers together and eventually registered a welfare association for them. So we are actually almost celebrating our 17th year since registration. As you know, May is Mental Health Month, and Kewota, under its agenda, vision and mission, has put mental health for teachers at the center of its leadership and management. And we have realized, after doing a lot of desk review, reading events in the papers, getting data from different organizations who have done research, especially the medical company that is covering teachers, that mental health is a major problem in the teaching profession. And we have listened to the country and tried to hear or find out who is thinking about the teacher. But we haven't had any voice thinking about the mental health of teachers. And so, having found out also that the employer already has a wellness center, we went and tried to find out how many teachers visit that wellness center. But it turned out that very few of them visit the center. And the wellness center provided by the employer can hardly take care of half the number of teachers, because teachers are now almost 400,000. So teachers have nowhere to go. And having talked to our partners and stakeholders within the education sector, we decided that we must provide a practical solution, something that is sustainable and that can make teachers have ownership of the process and can see viable results. So we are actually coming up with a very unique institution for teachers. And to put up this institution, which I will talk about as the interview goes on, we are looking for funds to start the process. And these funds we are going to raise them through a walk. This walk is actually for raising awareness on the mental challenges that teachers are facing. So basically, the walk is for teachers. And you know, everybody in this country has a teacher. And there's a teacher who they would want to do this thing for. And that is why we know that this work is going to succeed, because it is meant for a noble cause. To provide a wellness center, wellness, counseling, and even training center for teachers so that they can perform their duties well. As you know, every campaign must have its milestone. And for us in Kewota, we are aiming at ensuring that those who support their favorite teacher or their teachers in their institution can do these 10,000 steps for their teacher and on behalf of their teacher. So our rallying call is for everybody to try and walk, remembering the challenges that teachers are going through. Now, research and data has shown that within the last 2 years, 60 teachers have committed suicide. And the record is outside there. It has also shown that within a very short period of time, a lot of teachers are undergoing mental stress and anxiety. And very few of them seek medical attention. And maybe we do not know what happens to the 35% that have never even realized that they have this problem. So this is the inspiration behind all this. The impact that this program will have is great and may be underrated and should not be underrated, because one, with the presence of that institution, teachers will for the first time have a place they call their own, where they can go and they can be listened to and given the proper medical attention that is required. That is number one, because this will be their home. I say that proudly because most of the problems that teachers are facing, when we interview them, some of them they say, some of them come from the employer. And if the employer could be the one causing this problem, the employer cannot be the one to provide the solution. Somebody else must do it. And that is where we come in. So once they feel and have ownership of this institution, we will see teachers' mental health improve tremendously. And then once that happens, then quality of education will go up naturally. Because when you have a teacher with a mental problem, like for example, a teacher who has become alcoholic, they can't perform. Overall, then it means the quality of education in the country will always be compromised. And I can assure you that if you ask anybody on the streets there about their teacher, their favorite teacher, many will tell you, a percentage will tell you that I don't know where my teacher is, because nobody keeps that record. Nobody keeps the record of a teacher who is having a problem. But now we are providing that solution, and we are actually filling that gap that has been there. There are very many reasons why teachers have mental challenges. They start from financial, because of poor financial management. Number 2, poor pay. Number 3, anxiety from where they are taken for transfer, because some transfers are breaking marriages and separating families. Others are because of where they are posted. Either the ethnicity of that area does not welcome them. We have had a lot of cases from Northeastern, and we have issues of fear of being attacked and being killed. So the reasons are many. It's huge. So we are just here to provide that solution. Just by giving you statistics, in 2021 alone, a lot of teachers were identified by the medical provider that they had mental disorders. And the research showed that 35% of these teachers who had mental disorder never got any help, never received any help. I have also told you that within the last 2 years, 60 teachers have committed suicide. Many are not recorded and covered by the general media. I'm also informing you that there's completely lack of awareness of this that I'm describing. And because of that, there can be no solution, and therefore the teachers suffer a lot of stigma outside there. When a teacher comes to school when they are drunk, it becomes a story within the staff room. Then it becomes a story within the institution, with the students going to tell their parents their teacher is always drunk. Then the parents will come to the school, they want to chase away the teacher, and the teacher immediately falls into a depressive state. And this is not being addressed anywhere. So these are some of the challenges that I'm telling you, that this is actually even affecting the teachers, even in the community where they live. It is a real issue. And we have zeroed in on many of the, after looking at many of the issues that the teachers are undergoing, one of the major gaps is about financial literacy. How to teach, we have to train teachers on how to understand what is money, how do they save, how do they manage this money, because every time the employer increases the salary of a teacher, the first thing the teacher looks at is the ability to borrow a loan without a plan. And when they do that, they fall into the cycle of depression and stress. We would like, even after the work, that the community at large come to volunteer to support this initiative. The volunteer can be in the form of providing counseling services, supporting our financial programs that towards this institution. Corporates can decide to choose through their CSR programs to support teachers who are visiting the institution in terms of paying their any requirement that may be required. Many teachers sometimes may have even problems. Maybe a teacher doesn't even have a water tank, and we have many companies which just produce these tanks. I mean, I'm giving a very, very simple example that they can offer us support that can ensure that the stress level of the teacher is reduced. And as Kewota, we have got mid-term, short-term, and long-term goals to address this matter. The short-term goal is to ensure that even before we put up that institution, we get a place where these services can be provided immediately. And individuals and corporates can support us by either supporting the experts who will be coming to train, paying the rent for the place, and we really want people to come on board to help us there. Then our mid-term goal is eventually, and long-term goal is eventually to move to our place. Now, this is the place that we want the teachers to own. And our estimation is that this center, for it to be effective and fully functional, it will be a budget of about 100 million shillings. That is money that people can raise for us to help support us. But in this current work, we are targeting 10 million shillings so that we start the process of helping our teachers. And we are doing a lot right now, apart from the meetings that we are having with our staff and departments. We are involving now stakeholders, especially in the education sector. We have written and invited all stakeholders in the education sector, including Teacher Service Commission, Ministry of Education, all the unions, all the associations. Then we are involving head teachers through KEPSHA and KESHA. Then we are involving students and teachers, and we are returning back the community effort which we used to see long time ago, where we involve students in raising funds for a noble cause. And that is how we are going to move forward with this project. Mental health with its various facets: alcoholism, gender-based violence, suicide, death, murder, all those things. We want to create awareness that it is happening, and it is happening to teachers, and it needs to be stopped. We are also planning to have this thing on a yearly basis. So we are creating a social movement that will ensure that everybody is involved, especially you and me, because all of us have a favorite teacher who we can do this for. And in fact, during the walk, we shall be having a tribute wall. Everybody who will come to the walk shall sign the name of their favorite teacher or teachers on a large canvas, which shall be shared with the world, so that people can know that teachers matter. I think the other impact which I have talked about also is we shall see in the medium term and in the long run a serious improvement in quality of education, because teachers will be more happier and they will deliver better and they will look to the future, not to want to stop their life. And lastly, we want to remove the taboo. You know, in the community, a teacher is not even allowed to make a mistake like any other human being. So there is a very big taboo about mental health amongst teachers. When a teacher is undergoing mental health, she has nowhere to run to. It affects her family, it affects her students, it affects the relationship between her with the community and even with her relatives. Many a times the teachers remain alone because people look at them as the solution providers. So when they have the mental issues, nobody goes to them. So I think this work and the establishment of that institution will ensure that teachers are provided for.
How can people or organizations join to support this initiative?
Thank you very much. So the work I have said is on 26th of May. And initially we had planned only to work in Nairobi, but having engaged stakeholders, we are going to have the work in 5 counties. So we shall be having a walk in Kisumu town, we shall be having a walk in Machakos, we shall be having a walk in Kiambu, and one in Nakuru. So we are welcoming everybody, stakeholders and sponsors, to please come forward and support this very noble initiative. Corporates can come in, and those corporates who want us to brand them on the t-shirts can come in and support us. We have got a package for every sponsor who will come and support us. We can give one organization the title sponsorship so that we showcase them. And the amount are going to be in all the invitation letters. So corporates, please come up, buy t-shirts for us, buy water, support us in ensuring that your children come for the walk, let them fill the forms, and in that way you will help us. However, we are also asking teachers to take time off because the walk will be on a Sunday. All teachers across the counties that I have mentioned, please come out in large numbers, buy a t-shirt and come and support this initiative, which is one of your own. It is the one initiative that has never happened in Africa. And we are the first ones to do it, and we want everybody, every teacher, to own this process, okay? You can come as a corporate, you can come as a team. So if your organization is supporting us, bring your staff And immediately after the walk, we are going to provide for you a room where you can get together with your own team and take 10 to 20 minutes to talk on how to improve your organization. So there is a very, very good time for you to build your team after the walk. We also have free medical camp, which is going to be provided by one of our partners. So please come in. If you want your logo to appear on any of our documents, please support us, reach us, and you can reach us through our website, which is www.kewota.co.ke. There'll be opportunity for you to display your signage for the corporates. There'll be opportunity for you to have fun, high energy dancing, and there'll also be opportunity for you to interact with other partners through a very powerful networking process. Now we are asking also individuals to come. Even if you are not coming for the walk, please buy our t-shirts or support us financially. We shall be sharing the pay bill number you can use on all our accounts. All head teachers, we are asking them to release the students. If it is a boarding school on Sunday, allow the students to come and support you. Students love teachers, and I'm sure many of them will come on board. So there's a special announcement, of course, that I would need to make. We know in this country we have a hospital which is called the Nairobi Women Hospital. But it's not only women who go there. That hospital also takes care of men. So is Kenya Women Teachers Association. Kewota, though, is an institution that is meant for women teachers, has, interestingly attracted the interest of a lot of male teachers. So I want to talk to our male teachers who are outside there. This organization is also yours because you have welfare issues. In fact, some of them worse than our female teachers, because women teachers are easy to know it's easy to know what's going on with them. They talk a lot. But the people who suffer more mental health, as per our research, are the male teachers. So this institution is going to be unique in this way. When you walk into that institution, you reach the reception, you go to the assessment room. And once you have been assessed, we know what your issues are, what is the root cause. So you will be taken to a financial solutions department, a marriage counseling department, and illness department, because some of these mental issues are brought by just illness or cognitive misplacements. And then you will also be taken to a place where you can be given counseling. It really depends on what the assessment will bring out. And the assessors are professional doctors. We already have a working partnership with an organization of professional mental health doctors who are ready to work with us. So when you come in, that is what will happen to you. Now, we have realized that the male teachers are very private and would like their issues to be handled in the way men like being handled. So we are going to have separate, sections for men and separate section for our women teachers. So I want to encourage them to know that this thing belongs also to them. It's not really for women teachers. And we will have a social hall where, if the recommendations from the doctors, whatever they give us to tell us to do to the teachers, if it has to be in terms of socialization, they'll have a place. Women teachers or male teachers who will be suffering under gender-based violence or domestic violence will have a place where they can actually even stay for 3 days while they are being counseled and assessed. And then we are developing a clinic. Now this clinic will be opened to the public so that it becomes an income-generating program to sustain the institution. So that is, in short, how this institution is going to work. My final remarks on this initiative is a call to the whole country. I want to talk to the people and tell them that when a teacher is mentally disturbed, the effect will cut across to the students and will likely result in poor quality of education. And this will affect the community at large. So I want to answer the question why? Why the work? Number one, we want to raise funds towards establishing a teacher wellness center, which will be the first of its kind in Kenya and in Africa. Number two, the work for awareness is not your typical charity work. The environment will be upbeat, entertaining, and unique. So we want to welcome everybody to come and see what is in store for them. Number three, the work is a very positive thing to do because it creates a social movement that is aimed at bringing the community together to salvage the core of the children growth in this country, and that is the teacher, because the teacher is the greatest agent of change for your child. Number four, we must remove the taboo and shame shrouding mental illness and suicide in the country at large, not only for teachers. Number five, we want to empower teachers with life experience to seek help for themselves, including the school workplace. Number six, create a unique, safe, upbeat, and entertaining event that connects people with people and encourages conversation and action on mental illness. And lastly, we are going to be creating an ongoing community of walks for awareness warriors. Thank you very much.